Hi, I'm Marita Macdonald from DentisTV, and I'm at the British Dental Association's annual conference and exhibition 2011 in Manchester. And I look forward to interviewing some of the speakers, exhibitors, and key opinion leaders at the show. I'm speaking with Dr Rian Cloete, who is the sole distributor for Intralock in the UK and the Republic of Ireland. Rian, can you tell me a bit about how you first got involved in mini implants?
You won't believe it. I was at the American Dental Association meeting last October in Orlando, and by chance I walked past where Dr. Shatkin was giving a lecture. And I was very interested because I've been a dentist for 40 years and implants never always sounded too difficult. So I decided this I can maybe do. So I started listening and asking questions, and that's how I started.
Okay, and tell me how you got involved in the Intralock system.
Dr. Shatkin is the world leader on mini implants or small diameter implants, and he uses Intralock because that's by far the best and the strongest of all the mini implants.
I see, okay. And if a dentist was interested, like you, to go into the world of placing implants, how do you suggest they start?
The correct way to start is Dr. Shatkin is coming out 2 times this year. The first is in August the 20th at the Heathrow Holiday Inn. He does a day course, and 2 days later in Birmingham, 22nd of August at the Hyatt. And courses are, after that course, you can place your mini implants, and it's very, very, very easy.
Okay. And how did you learn about the particular Shatkin technique?
The Shatkin technique is a patented technique because you can't go wrong. If you follow the protocol of the Shatkin technique, you have any help or all help. Your cases are designed for you. Everything is like happen the way it should, and you can go no wrong.
Okay, all right. And in closing, what else would you like the viewers to know about Shatkin First and the Interlock system and mini implants?
I want the people to know that mini implants can be put in by the normal dentist. Mini implants can double your turnover. Mini implants are easy. They are pain-free. Patients appreciate that. And that's a third of the cost of the traditional implants. And that is absolutely, people just love them.
Okay.
And you can go on my website, www.vegadental.com, to read all about the Shatkin and the Intralock system.
Okay, fantastic. Thank you very much.
Thank you.
I'm here with Dr Peter Bateman, who is the chair of the Salaried Dentists Committee for the BDA. Peter, thank you so much for joining me. I'd like to ask you a few questions. In particular, this year's conference comes at a time when there is continuing uncertainty about, for salaried dentists. What are you hearing from colleagues at the conference about in particular, the transforming community services agenda?
I think we're in the calm before the storm. I'm hearing a little bit of bad news, but I think people are still settling into their new organisations and getting to know each other.
Okay.
So I don't think we've seen the worst of it yet. I think there will be some threats to services when organisations know what budgets they've got and what they're doing, and there's going to be a need for a lot of defending. But I've already heard some inappropriate stuff going on, some training that's been going on, that's acute trust training programs that aren't relevant to dentistry that people are being forced into.
Right.
But I think it's going to get worse. I don't think there's a lot there yet.
And so moving on from that, the salaried services are often forgotten in the debate when it comes to the NHS reform. What would you say is the mood of salaried dentists at the event this year?
It's interesting. It's one almost of fear and defiance. We had our annual conference of our accredited representatives. That's, if you like, the union conference on Wednesday. And there was a special motion put forward, which is essentially that we were going to stand up and defend the service and the service to patients. But what was fascinating about it was more of the speakers to that motion were more concerned about the patients and the service that disabled and special care patients get than perhaps their own livelihoods. And that's the fear, that in this new competitive NHS, it's the vulnerable patients that we look after who will get cut out and shut off, and they're fearful.
Sure. So some really serious issues that people are talking about here at the conference.
Absolutely. They really are trying to say, look, the new NHS is fine for those that have got choice and can make choices, but when you've got commissioners looking to save money, it's those that are expensive to treat that people start questioning, because, to be honest, most people who make these decisions don't understand how difficult it is to treat someone who's got special care, disabilities, doesn't sit in the chair and open their mouth for you, and you have to work darn hard to get small gains.
Okay. Peter, thank you so much for your time.
You're welcome.
I'm speaking with Professor Iain Chapple, who is a professor in periodontology from the University of Birmingham School of Dentistry. Iain, you've just presented a talk here at the BDA. Can you tell us a little bit about what your presentation entailed?
Okay, it was a tour of the diseases that affect the body, the systemic diseases that affect the body, and how they present in the mouth.
Okay.
Done in a way that hopefully can be applied in practice. So it was done in a sort of an algorithmic way, so that people can follow a journey and try and get a diagnosis for these important conditions.
Okay. And what were some of the questions that you were asked? I believe there was quite a queue afterwards to speak to you.
Yeah, a lot of personal questions about personal patients.
Okay.
Some people with iPhones with pictures on them. And interestingly, a number of conditions that actually were quite serious conditions that they were worried about but didn't really know how to manage them. What was interesting was it was actually the younger graduates that were picking these things up, because they're fresher out of dental school. And obviously, as you spend more and more years in practice and you deal with so many other pressures, sometimes these things just fall into the back of your memory a little bit.
Okay. So certainly in the scientific evidence that's coming out now, the link between systemic and oral health is very clearly identified. Can you tell us a little bit about what the latest evidence is showing about these links?
Yeah, there's an awful lot of misinformation out there.
Okay.
There's two types of studies that look at the evidence. There's a type of study that's called an association study. And with those studies, what you do is you look at one moment in time and you ask a very simple question. Do patients with periodontal disease have more cardiovascular disease or more preterm low birth weight babies, for example? And you show an association or a relationship between the two. What that doesn't mean is that it's due to the periodontal disease. Because, for example, it may well just be that they all smoke, or they all, have the wrong diets, or they don't exercise. So there may be lifestyle factors, and we call those confounding factors. They confound that relationship. And then the other type of study is more of a longitudinal study or an intervention study. Because if you really want to prove that the link between the periodontal inflammation and the general health condition is a causal link, what you need to do is treat the periodontal disease and then show that that condition gets better. And we have that evidence for diabetes, and we're starting to see that evidence for cardiovascular disease as well. We do not have that evidence for preterm low birth weight. All the big studies that have been done, the really big studies, have shown no impact on preterm low birth weight of periodontal treatment. And the only exception to that is the risk of stillbirth, where there's still perhaps some evidence that there may be something going on there.
Okay.
So I'm afraid the preterm low birth weight data, I don't think is there. The evidence isn't there for causality. We're starting to see evidence for cardiovascular disease, and in fact the cardiovascular community are very switched on to this. They're running conferences in cardiovascular medicine on periodontal disease.
Okay.
And they're giving clear advice to the cardiovascular physicians about it. And the evidence is there for diabetes. It's pretty robust. And we're starting to see evidence now for rheumatoid arthritis as well, and chronic kidney disease.
Iain, thank you so much for this information.
Pleasure.
I'm speaking with Professor Giles Perrier from the School of Dentistry at the University of Birmingham. Giles, tell me a little bit about why you decided to leave 25 years of dental practice to become a full-time dental teacher.
Well, practice 6 days, 5 days a week is a very draining experience. It requires a lot of stamina. And in my practice, I've always tried to do something a little bit different for 1 or 2 days a week. And vocational training, being a postgraduate tutor, there are lots of little jobs you can do to break the week up. In about 19, well, I won't say 19 what, I'll give my age away, I became a part-time clinical teacher at the University of Birmingham, and I really enjoyed it. A chance to meet peers, discuss difficult dentistry and teach students. It provided a great little break in the week.
Sure.
10 years of that, and I started to think, actually, I so much enjoy the teaching, and in general practice, I felt I was starting to repeat myself, and I made I thought, rather bold decision to sell the practice and then move to the University of Birmingham, where I remained part-time for about 3 or 4 years, wondering, should I go back to practice? But last year I decided, no, I'm going to go 100% for teaching, because it's such a great job, and it's a really nice way to end my career.
Okay. So, what subject do you actually teach at the University of Birmingham?
Well, being a general practitioner, I'm a bit of a jack of all trades when it comes to the clinical teaching. But so I'm on the clinical practice unit, where our students have their own patient list, and they treat them as if they were general practitioners. Virtually all the care, whichever specialty, is done on the clinic. I'm also very interested in teaching the new unskilled students who've just finished their preclinical work, where they work on the phantom heads, training them up to develop the manual skills that are needed to do dentistry. And I occasionally teach on the conservative dentistry unit. Strangely enough, conservative dentistry was not my strong subject at all as a student, but I've got reasonably good at it over the years, and I think that gives hope to a lot of the students who are struggling at the start of their careers.
Okay, and just to wrap up, tell me what you've seen or what you've noticed being here at the BDA conference. Anything interesting on the program that's caught your eye?
Lots of boys' toys. I think cone beam tomography, it's the latest big expensive boys' toy. Also, the BDA show over the years, which started as a relatively minor event in the calendar for many dentists, it seems to me each year is getting stronger and stronger, and actually moving towards top spot as the most important show in the dentist's calendar.
Okay, fantastic. Thank you, Giles.
Well, it's a pleasure.
That's it for this show here at the BDA Conference and Exhibition in Manchester. I look forward to seeing you on the next episode of DentisTV.